Dr. Wachter, there's been what I sort of previously considered to be some loose talk about whether we should worry about the president's ability to carry out the duties of the presidency, given the COVID treatments he's taking. Whether or not specifically the steroid that he's taking is something that might have cognitive or mood altering effects on the president that should worry us in terms of the kinds of decisions he's making. I've considered that to be sort of people over worrying. But now we've got news from the New York Times that there are White House officials who are worried about that. The Speaker of the House gave voice to that worry tonight. Are we overthinking this, or is that something that is potentially a real concern?
I don't think we're overthinking it. It's hard to say for sure without him being examined by physicians, and I would love it to be independent physicians. But what we do know is that not only does that medicine, dexamethasone, frequently cause mood swings, even manicness, euphoria, but COVID can also alter your thinking, and particularly in elderly people. When an older person comes into the hospital and they're not thinking clearly, they're confused, the first thing we think about is an infection. So for a 74-year-old man to have COVID, symptomatic COVID, low blood oxygen, which can also alter your thinking, and be on dexamethasone, it certainly raises the possibility that his thinking is altered, his judgment is altered from the medications. And part of the problem is if he is the one responsible for figuring out whether he's capable of thinking clearly, that's not a good plan. I would say, of the hundreds and hundreds of patients I've taken care of who have altered thinking, it's not at all infrequent that they have no idea. It's one of the things that happens. They lose insight. They are unable to tell that they have a problem. It's the folks around them that can tell that. So I can't say for sure that there's a problem here, but it certainly is possible given the medications, the low blood oxygen, and the infection itself.
Dr. Wachter, you're saying some stuff that is rattling me a little bit. I'm going to break the rules here a little bit and ask you if you wouldn't mind sticking with us to the other side of this commercial break and coming back so I can ask you some clarifying questions, because you've unnerved me a little. Would you mind staying with us?
Happy to. Thanks so much.
Dr. Robert Wachter is chairman of the Department of Medicine at UCSF. He'll be right back with us after this. Joining us now once again is Dr. Robert Wachter, chairman of the Department of Medicine at the University of California at San Francisco. Dr. Wachter, thank you for sticking with us.
Pleasure.
Before we took that break, you were affirming the concerns that have been voiced by anonymous White House officials tonight to the New York Times, and that we've heard other people discuss in recent days, that the president may be impaired in his decision-making and his thinking, both by COVID and potentially by some of the treatments that he's on, specifically thinking about that steroid. You said that among the hundreds of patients that you have treated who have had some sort of impairment like that, you wouldn't trust them essentially to decide whether or not they are impaired. As a physician, is there testing that you do? Is there a way that you can discern whether or not somebody is impaired in their thinking or their ability to understand or impulse control or anything else that might be affected by these drugs or by this illness?
Well, it's a little tricky because obviously some of this depends on knowing their baseline personality, whether someone is manic or is that the way they are normally, or is this unusual for them? Are they acting erratically? But there is neuropsychological testing. There are formal ways to test not just memory, but judgment. And whether he requires something quite that formal or something a little less formal, the key point is it certainly is possible. It would not be shocking, given his condition and the medications, that there are alterations in his thinking and his judgment, and he should be assessed for that by someone who is other than him.
Just to be clear, you believe, as somebody who with experience treating COVID patients and administering the kind of treatments that COVID patients with serious illness have had, that there should be that kind of an assessment done of the president now medically?
Now, it's possible that his physicians are doing that. In fact, he's being seen by physicians every day, and I assume one of the things they're doing, which would be routine in a patient with COVID and who's on steroids, is to assess his thinking, his judgment. So I can't say that that's not being done. I just hope it is being done, and it's going to be important that they render their judgment independently. I mean, one of the concerns, of course, is that this is not only their patient, but their boss. And clearly, when we heard the press conference the other day where the physician was saying, I'm basically playing to my boss and I don't want to give you too much bad news because he's watching, just think about the position they're in. It's extraordinarily difficult, but it's incredibly important that we get this one right.
Dr. Robert Wachter, chair of the Department of Medicine at UCSF. Sir, thank you for being here. Thanks for sticking with me. I appreciate it.
Thanks for having me.
Oh, that is sobering stuff.